Hello and welcome to the Fertility Foundations podcast, where we go into detail about how to prepare the foundations for a healthy pregnancy. We dive deep into the underlying root causes for fertility issues and natural solutions. I want you to know that you're not alone and you're not broken. I hope that by sharing these episodes, they will help you move from feeling overwhelmed and lost to feeling hopeful and empowered to take charge of your own path to parenthood, because there are actually lots of things that you can do to help rewrite your own story. I'm Sandra Greenbank, nutritional therapist, functional medicine practitioner, coach and educator, specializing in fertility, pregnancy and postpartum health. I'm also the founder of the Fertility Nutrition Center, where you can find fully trained experts in nutrition, lifestyle and functional approaches to a healthy fertility and pregnancy. You can find more information over at www.fertilitynutritioncenter.org and also book a free strategy call with one of our experts. Today I'm speaking to Ian Stones about male fertility. Ian is founder and co-director of testhim, a company aimed at changing the world of male fertility. With over 15 years experience as a practitioner supporting couples going through fertility difficulties, Ian knows how much of a battle infertility is for men and that they're often the neglected part of the equation. Through testhim, Ian is keen to do all he can to tackle male fertility head-on. testhim's mission is to provide guidance, education, comprehensive tests and ongoing support for men so that they can feel properly empowered about their health and fertility choices. Before we get into the interview, I wanted to talk a little bit about our podcast sponsors, Neovos. They're a UK lab that provide at-home health tests and cutting-edge analysis. I personally like their vitamin D and omega-3 tests, which are absolutely crucial to get right for anyone trying for a baby. Knowledge is power, and in my opinion, you need to always check, not guess, your levels of omega-3 and vitamin D so that you can supplement correctly if you need it. I have found the Neovos test really easy to use and affordable too. The Neovos team have kindly offered our listeners a 10% discount on their website using the code fertility at the checkout. Their website is simply www.neovos.com. All of these details are also in the show notes for you. Now let's get into today's interview with Ian. So hi Ian, thanks so much for joining me today on my podcast.
Well, thank you very much for inviting me in to chat with you. I'm really looking forward to this. Thank you.
Yeah, me too. So for anybody who doesn't already know you, would you mind just giving us a brief introduction to you and to testhim?
Sure. Yeah. So my name's Ian Stones. I'm one of three directors of testhim. There's myself, Toby Trice, and Michael Close. And we've come together on our mission to change the world of male fertility and help men kind of understand that they have an equal role to play when it comes to starting a family, help them get educated, but importantly also help them access the right tests, get the right diagnosis and get the right treatment and the right support. So that's really kind of the three of us. And my background was very much from a therapist kind of background, similar to you, Sandra. You know, I was an acupuncturist and I saw over years and hundreds of couples how little was being offered to the man, and actually that needed to change. And that's how it kind of evolved really in terms of the three of us getting together and doing what we're doing.
Yeah, I agree. I've been doing this since 2009, which seems like a lifetime. But in that time, I've only ever had one male partner drag their female partner into my clinic.
Wow.
But usually it's always the other way around.
Yeah, isn't that funny? I mean, you know, I had 15, 16 years as an acupuncturist and I did a lot of advanced training with Zeta West. So I was very fertility focused and I can probably remember, I can remember a lot of my patients, but, you know, every single guy, you know, because there were so few of them that actually came for treatment. But when they did come for treatment, it was absolutely fantastic. And I really, really enjoyed working with them.
Yeah. We also actually at the Fertility Nutrition Center, we were saying how much we love working with men because they just do what you ask them to do. They don't have the hang-ups and it's just like, okay, I'm going to do it. And if they say they're going to do it, they'll do it. And it's really, really lovely actually as well to see. Also sometimes when they're a little bit reluctant to start with and they sort of come in with their arms folded and then how much they also enjoy it and just seeing that change and the dynamics in the couple. But you're doing really great work with getting the information out there. But I think one of the main things that I'm so grateful for is that change of conversation and bringing the man into the room. and also normalizing it.
Yeah, and I think you're sort of saying about when guys do come in, they're willing to make the changes. It's just getting them over the threshold, isn't it? It's getting them in the door to chat to somebody like you, or to go and see a reflexologist, but also go see the right clinician. Once we've got those men over that threshold and in and talking to somebody, they then realize how much support and knowledge and information is available from all these fantastic professionals. And they're like, oh, actually, that there are people that can help me, because so often the guy is the neglected part of the conversation. Mm-hmm. Certainly when a couple end up in front of a consultant, often a gynecologist, or even at the GP level, they immediately are kind of pushed back to not feel as relevant, because there's so much focus on the woman. So I think when the guy then does get to talk to somebody, and that person's given them valuable information, they're like, oh, okay, this is really useful. And then they engage, and like I say, then they want to do the homework and want to make a change. And us guys I think we're very driven by results, aren't we? And it's very easy with the semen analysis to say, oh, look, my concentration's gone up from 20 million to 30 million. This is great. They can see kind of cause and effect. So, quite responsive perhaps in that way.
And it can be really quick as well. Those changes can be so quick to see. Yeah, I wanted to talk to you actually about why this is, that the men are kind of, they're almost shoved into a corner. And even if, so I don't know if you have the same experience, but it seems like people have a very borderline semen analysis result, and they just get told that everything's fine. It's always fine, but we're not, first of all, we're not looking for fine. We're looking for great.
Yeah, we want exceptional sperm.
Yeah, and also there can be some really questionable things on that test result, and they still get told it's fine, and all they need is ICSI.
Yeah,
and that's the solution.
I've literally just come off a consultation with a couple where we've had this exact conversation, and his semen analysis, it wasn't fantastic, but it was okay. But yeah, the number of times I've worked with couples where they've been told fine, I was like, okay, what does fine mean? Can I actually see the results? And then you see those results, and that fine is, morphology is just slightly under, motility is slightly under, pH is slightly raised. It's like, okay, this could be a sign that there's something else going on. So yeah, it's really important we empower men to understand their results and understand their options, and realize that there's so much more that they can do and other tests that they can consider.
Yeah, and we'll come to the other testing as well. But I think I can see a change in the landscape also with the kind of how men really do want to become part of the conversation as well. And it's almost like the clinicians are still pushing them back, and they want them in that corner. But actually, and especially it must be so hard emotionally to watch your partner sometimes actually have treatment on your behalf, and quite severe and invasive treatment, because your semen is not good enough for natural conception or whatever it might be, and then it's just this grueling treatment that your partner has been put through. Must be so hard.
It's so tough on men emotionally on so many different levels. There is, because there is this expectation, societal belief that fertility is a female issue. So the guy goes into this with no, okay, right, we're going to try for family. The guy goes in with no idea that he may be part of the issue. There's no kind of belief that he's got a role, a significant role to play. I'm perhaps not explaining this very well, but there's no thought from the guy that he could be the problem. So off they go. They try, it doesn't work. So when he gets that message that his sperm's suboptimal, it really has a massive impact on him, because it cuts straight through to the core. Because it's a huge shock that it could ever be him. There is this kind of belief that a man's fertility is directly correlated to his masculinity.
Absolutely.
So he then feels like less of a man because his sperm's, a bit squiffy. So he's got to deal with all of that. But you're quite right that men typically through fertility treatment are just worried about their partner. They're worried about the fact that she's going to have all these investigations, these internal examinations, all these hormones. And the guy feels utterly helpless. He just doesn't know what to do, doesn't know what to do for the best. So if he's dealing with that, and then he's found out he's got poor quality sperm. And as you say, the woman's going through treatment because of the poor quality sperm. I mean, just absolutely annihilates him as a man, and kind of that urge to be the provider and the protector. So then men are kind of dealing with these really big emotions of guilt and shame and kind of feeling emasculated. But where do they go and who do they talk to? Because if they take that down the pub, which they shouldn't feel like they shouldn't be down because they've been told not to drink, but if they take that to the football club or anywhere else, chances are if they speak up, some bright spark's going to turn around and say, "Oh, don't worry, mate. Send her around my house. I'll get her pregnant." But this is the unhelpful banter that goes on between men sometimes because it's not part of our normal conversation. So other men don't know how to handle it. And banter is great and comedy is great. And it really helps break down some of these taboos and whatever. But it's got to be at the right time, at the right place. So if a man's been brave enough to speak up, actually, it's okay to say to him, "Oh, mate, that sounds really crap. Do you want to grab a drink? Do you want to talk about it?" Or just acknowledging it could be enough. So it's a real minefield for guys to navigate all of this and to feel safe to open up. And I don't think, much as the narrative is changing, we're not quite there yet where any guy could stand up and say, "Oh, look, I've got no sperm, or I'm infertile, or my sperm's really poor," and that he's then that is well received and well supported. But we're getting there. And the more men that we reach and help understand and make them feel confident to do this, and the more that do speak up, it helps break down that stigma and hopefully change that conversation forever.
Definitely. And I think that actually all the sort of fertility in the workplace type education and the things that are going on as well alongside, I think it's really helpful as well, because it's just hearing about people. And a lot of the time is, once you've been through the trauma is when you're then ready to speak about it, I suppose. And then, but people actually talking about their experience and that they've been through it. And, I think that can be so helpful as well. But I 100% agree that men just are not great at talking about things, are they? Generally. But I mean, that comment that you just mentioned, that's just awful. And I've not even thought about it in that way. But I mean, that would be so crushing. And I think men are natural fixers, aren't they? They just want to fix the problem. And they are just told that there's nothing you can do. And they literally this is what they're told. There's nothing you can do. But that's not true. And we always encourage couples to come together, regardless of whether they're male and male partners or female and female, or, whatever setup you have, come together, because there's something so empowering about you being able to cook a meal together and enjoy trying new recipes together, changing your lifestyle together, rather than, one partner kind of going, "Well, you're supposed to give up smoking, you're supposed to give up sweets, you're supposed to give up all of it," and then having all this in front of them potentially, or buying it. And it's just so, the dynamics are so, it's just so unhealthy, because then it just raises stress levels and all of these things, which are also not healthy for you. So I think even if one of you has been told that there's a problem on your side, the other person absolutely has a role to play in so many ways. And, it's not about, you don't really have to talk about it and sort of go over it in that sense either. You can just, there's so many other ways you can support each other, isn't there?
Yeah, and it's a partnership, isn't it? It takes two to make a baby. And it can be great if you've got a kind of united front and you tackle it kind of as a partnership. Whereas typically what we see is that, I don't know, maybe 80, 90% of the time, the woman takes the lead, and she's the one that's done the research, seen the nutritionist, gone on the forums, spoken to X, Y, and Z person, and done all this, that, and the other. And the guy is kind of just tagging along and being told what to do. Whereas actually, if we empower men to be part of the whole picture and to have somewhere to go and find information, to talk to people, to get resources, and that, like I say, they can say, right, okay, cool, we both need to work on this equally. Let's sit and do a meal plan together. What do you want to eat? What do you need to eat compared to what do I need to eat? How do we combine that and make it? I think men sometimes quite like a project. I was like, okay, right, how do I make this project? Let's make it a 3 6 month project to improve my sperm. How does that look? Looks like this in terms of my diet. I want to do this in terms of my exercise. I need to cut down that. I need to improve this. I almost sounds like I'm trying to make it fun. What we've got to bear in mind is that some of these couples are 2 years, 3 years into trying to conceive. They might have had several miscarriages. Sex is robotic and boring, and just programmed into the schedule. So it's not easy to pick yourself up and kind of say, okay, right, well, let's come at this with a new kind of zest and excitement. But maybe if we had couples better prepared before even starting to try and conceive, then actually they can put all the right stuff in place before they even, enter into the bedroom,
Yeah, I mean, that was my big ambition 15 years ago. I was like, I'm going to change the world. I'm going to go out there and tell everyone that this is the way. But, of course, it just doesn't happen. They come to us once they've had lots and lots of failed cycles usually. And that's fine. I understand it. But because we all get told that, you have to be careful because, the minute you look at a man, you'll get pregnant. And, it's sort of imprinted in us that this is what's going to happen. So you'd never go into believing you're going to potentially have a problem. But
I'd just say on that point though, Sandra, that because we were with Jonathan Ramsey last night for a webinar, and he was saying off camera, he said to us that actually he is seeing a change in the demographics of people coming into his clinic. And he's saying that they are seeing younger couples coming in for treatment or assessments now ahead of fertility treatment. So you might feel like you've not won that battle, but I think things are changing. So I think people are getting that message.
Yeah, things are changing for sure. There's definitely inquiries from people, and especially I think younger girls understanding that their cycle, if they have a problematic cycle, that this is something that is best nipped in the bud, even if they don't yet want to conceive, but they understand that this is kind of like a red flag or a symptom of something that they want to fix before it becomes a real problem. So I agree with you, but it's not this. It's not the proportions of people coming in is still those who have struggled for a long time, which is totally understandable. But so when it comes to testing, then what should you do if, say, you're somebody who has tried for a while and it's not worked for whatever reason? What should a male partner do? Is it seeing a urologist straight away, or?
It's a good question, isn't it? And I think there's always variables with all of this. There's so many different kind of things that can be going on. The man's age, the woman's age, the man's history, the woman's history. Bring the two together. When did they meet? How long they've been trying? Are they only just trying? There's so much to consider. I think first port of call for any couple that are trying to conceive, and if it's not going to plan, is to visit their GP. I think it'd be kind of very bad of us, no matter who we are, to be saying to people, don't go and see GP. That's got to be your first port of call. Just get the basic tests done. There's basic tests for the woman. There'll be a semen analysis, and unfortunately, that's all for the man. But there's a good starting point, and also going to give the GP a chance to check out any other history and any other issues that might be there, or any other red flags. Make sure they're getting picked up.
Yeah, medications potentially.
Yeah, all of those sorts of factors.
I mean, I wish that they would also do a hormone panel and just a full blood count for the male partner, but it doesn't tend to happen. But certainly if you're 40, you should have your 40 check. People don't really know about this, but we're all entitled to a check around the age of 40.
Yeah.
And really, if you've been trying to conceive, they shouldn't say no.
No, quite. So there's your kind of basic tests. And what tends to happen then, if a couple continue to try and it's not going to plan, then they'll get a fertility referral, and that's going to be to a gynecologist, potentially in an IVF unit. And that unfortunately sets the path and the pattern for the rest of the journey, which is very female-led. So, then the woman may have a high COSI, she may have more hormone profile, whatever. Definitely kind of more thorough investigations for the woman. And this is where the guy will be kind of sidelined a little bit in terms of the investigation. So there are a lot of other tests for men to consider. Our view here at testhim is ideally we would like men to be having all of these tests, ahead of trying to conceive, if they or after a year or 18 months if things aren't going to plan. So other things for men to consider would be, like, as you mentioned, a hormone profile. Us men have follicle stimulating hormone, just as women do. We have luteinizing hormone, just as women do. And then we have the importance of kind of the testosterone and estrogen balance and some other hormones. So, check the hormones. Let's see what they're doing. Are the messengers working properly? Because any imbalance there will give you a very good idea of whether the testicles are functioning as they should be. So that's one test that can be considered. One of the big tests that's getting a lot of publicity at the moment, partly from our work, but just generally in the fertility world, is sperm DNA fragmentation. A semen analysis is a very good first test, but it's only going to tell you how many have you got, are they swimming in the right direction, and what shape are they. So it's quite a crude test, and that's an embryologist looking down a microscope, looking at what's going on. But what it's not doing is looking at what's going on to the DNA in the head of that sperm. The sperm has one job, and that is to deliver that DNA from the man to the woman and get that into the egg to make an embryo. Create life, move that DNA on. So that's its only function. What a sperm DNA fragmentation test does is it looks at what's going on to that DNA in the head of the sperm, because it can get damaged. So this is a more advanced test that might be considered a bit further down the line for some couples, but it would be well considered if you've had IVF failures, or if you've had a recurrent miscarriage, or if you're kind of a healthy couple and you're 18 months down the line and things haven't happened. You might then want to look at what's going on in the DNA. Another test might be oxidative stress test. So this is looking at what's going on in the seminal fluid, so the fluid that kind of encompasses and supports the sperm on their journey. And what we know is, we know a lot about antioxidants, or we hear a lot about antioxidants, and they are there to counteract oxidants, free radicals, cells that go around damaging other cells, and sperm are very vulnerable to these. And the oxidative stress test can look at what's going on in that balance between free radicals and antioxidants, and make sure that you're in the right parameters, and that will then give you a good indication whether antioxidants are actually right for you to take or not.
Yeah, because you can overdo it as well, which is not helpful. And I think it's important to mention that we're supposed to have reactive oxidative species, that they're normal, is part of a normal process. But in this day and age, we are potentially exposed to more in the food that we eat, in the air that we breathe. And also over-exercising can be something that really increases your oxidative stress, and also being obese or certain lifestyle things that we're doing. So yeah, that can be a really good way to find out what's going on for you. But I think I still see, men just need to take antioxidants, and that's really damaging advice potentially.
Yeah, because as you said, we need a level of reactive oxygen species within our body for certain functions, and one of those functions is actually sperm function. So the sperm need reactive oxygen species to activate certain elements of their function. So if you wipe that out with too many antioxidants, your sperm then won't function that way. So yeah, it's deleterious both ways. A further test to consider is also a scan for a varicocele, or a physical examination for varicocele. So many men will never have anybody touch their testicles from a clinical world, because it's not done routinely. But varicocele, an enlargement of veins in and around the kind of testicles, creates excessive heat, which damages the sperm. 15% of the male population will have a varicocele anyway, but when you look at men that are struggling to conceive, that jumps to 40% or up to 40%. So it's probably one of the major players in terms of male infertility. So that's a really important element. So that might be a quick, simple ultrasound that could just check for that, or a physical examination. And then I think the other sort of final significant one is infection screening. Another kind of quite hot topic and possibly debatable area. I think the research is it's partly mixed, and there's so much about this that we don't know, I believe. But we do know that men can be carrying a low-level infection that's not causing any symptoms, so they haven't got a fever or they haven't got discharge from the penis or anything like that. But that the presence or that imbalance of organisms within the seminal fluid or the urinary tract can be enough that it will cause damage to the sperm. So again, that possibly needs to be tested for as well. So there are all these other tests that are available to men, but they don't know about them. And when they do hear about them, they don't know where to get them. And that's really our mission with testhim, is to help them find this stuff.
Yeah, when it comes to infections, there's two types of screenings that we would do. I suppose it's looking at the sexual health screening, which hopefully, I think it's something that everybody should do at least at some point. And, hopefully they're not carrying chlamydia or gonorrhea, or, could have been caused problem in the past. But also then there's, like you said, there's other bacteria that are not necessarily sexually transmitted, but and they might be commensal, which means that we might carry them generally anyway, and they're not always problematic. But it's about the levels then, and whether you've then got the protective mechanisms as well, and whether your immune system is able to handle those and keep them at bay. And so ureaplasma is something that we see time and time again, and it's passed between couples, and you wouldn't normally have any symptoms, but up to 70% of people who have been diagnosed with unexplained infertility carry this organism, and it's as simple as an antibiotic prescription to clear it. And it would be such a shame for people to go through failed attempts over and over again, and with all the trauma and the expense that you're going through, for this to have been missed. And it's such a simple thing to check.
Yeah, quite exactly. And this is so often getting missed because men aren't getting these tests as standard.
Yeah, I mean, we always test. Certainly, we always do a female vaginal swab, and it would come up. And if it then comes up on this test, we would always. So Mr. Ramsey sometimes tends to just then issue a prescription for him as well, based on this. Some clinicians would ask for a test to see if it's actually there or not. And so, but certainly if it's found in one partner, the other partner needs to be checked. And actually, they then need to use barrier form of contraception until both have been treated.
Yeah, exactly. But yeah, so many couples don't know this stuff.
Oh, I mean, the medics don't know. So, did they even test it for it in the clinics? I don't think I've ever seen it being tested in a clinic.
Well, it's not routine, is it? And this is the thing, all of these advanced tests, they're not routine. They will often, will sometimes be offered after multiple failures. So it's only then when a couple have been through several rounds of IVF, or maybe a couple of failures or miscarriages, then somebody might say, maybe we should look at the sperm in a bit more detail. And it's very back to front in that sense. I mean, obviously there's a lot of people that go and have treatment and they have success, and the sperm may have been a factor, and they got lucky. So we never knew there was a problem, never investigated, never knew there was a problem. But it, like you said, the heartache, the emotion, the hormones, all of that, for a couple to go through all of that, many times over, and then say, oh, maybe we should check the sperm, it's devastating. Check it early, get it tested, do something about it, and then you've given yourself the best possible chance.
It's so heartbreaking every time I hear, I wish we'd met you sooner.
Yeah.
It's just so heartbreaking, because what can you say? And, it's not your fault. If you didn't know, you didn't know. Your clinicians didn't know. They didn't recommend the test. But, how upsetting is it to go through life thinking, if I'd have just done that sooner, and so obviously we have access to all of these tests that you just mentioned, and we run them routinely. Mr. Ramsey, I mean, he's he's brilliant, and I just think any couple who are trying to conceive and who are struggling, they should see somebody like him. But he's got a long waiting list, and there's only one of him.
There is. Yeah.
Where else can people kind of go to find out more and to get these tests? I know you've got some things in the pipeline.
We do,
Yeah.
we have the testhim DNA fragmentation service is basically sitting ready to go at time of recording. I imagine our lab manager's just sitting there waiting for sperm to arrive. I think she's actually incredibly busy doing other stuff. But I kind of imagine her just sitting waiting for this service to be turned on. But it is going to be live very, very soon.
Mm.
Yes, we have the wonderful Jonathan Ramsey, but there are other andrologists out there, most of them sort of London based. So, if you're looking for these tests or looking for advice, they're the people to try and track down. We refer a lot to Professor Cheryl Homer at Andrology Solutions as well. But also if you're in an IVF clinic or you're in an IVF, kind of treatment pathway already, then do speak to your clinic. Some clinics are offering these tests. They do offer a DNA fragmentation service. We're hoping to work with some of the big clinic groups to have our service within their kind of offerings. So do speak to them. Do that. I think kind of it's the medical system still very kind of you must trust the consultant. You must respect and not kind of challenge. I think that's you can challenge, but challenge with respect. And if you're speaking to your consultant, say, look, I'm curious to find out a bit more about this DNA fragmentation, or perhaps the semen culture to look for infection. What do you think about this? Open up that conversation with them and see what they offer. And if you're happy with what they've told you, then great, go with that. But if you're not happy, then perhaps seek another opinion and try and find these tests. So some clinics will offer them, but you may need to go outside of your clinic provider and find another clinician that can order these tests and importantly interpret them and give you the advice as to what that all means and what your best options are after that.
I think this is one of the main problems, because some clinics will say you can have the test, but even if the result is poor, if you have poor DNA fragmentation, there's nothing you can do anyway.
Yes, we'll just do ICSI. But there are other options out there, which is, first of all, let's treat the man. Let's try and treat the cause of the DNA fragmentation. So if it is varicocele, let's see if we can get that treated, or if it is infection, let's do the antibiotics. But what we always have to bear in mind is kind of what I said right at the beginning is, if you've got a 41-year-old woman who's on the last knockings of her egg reserve, and you're only just learning that, the male partner's got sperm DNA fragmentation, you may not have time to fix that. You may not have time to have a varicocele embolization, and the minimum 3-month recovery period from that, more like 6 to 9, if not a year. So if you haven't got that time, then you may just need to push forward with treatment. But there are things like sperm separation devices, which are showing really promising results in terms of filtering sperm in a much gentler and kinder way. And some of the devices, hopefully there's a new one coming out next year that we're going to be supporting, is showing that it can reduce DNA fragmentation by anywhere from 50 to 95%. So you're then getting, as the sperm have gone through this device, you're then picking out really high quality, good sperm. That means, okay, ideally always treat the man, but if you haven't got time to do that, there might be other options. So again, these are conversations you can have with your clinic if they're not, open to doing anything else for the man.
I think that's great. And some of these devices are incredible, and the technology is incredible, and it's important. And I would never. I'm 100% all for IVF, ICSI, all of this, if it's needed, where it's indicated. I think what my issue is that it's like, we'll just do ICSI, we'll just use these devices, and then a potential kind of, because male fertility is kind of like the canary in the coal mine, and we know that if you have fertility problems, actually that can correlate with heart problems later in life and all of these things, and so it can be a symptom of actually something grumbling that's potentially going to become a problem in the future. So I still think it's actually a really good idea to check what's going on.
Absolutely. Yeah. I think, as I say, kind of, if you haven't got time, then we've got technology to support things. But if you have got time, then you're quite right, treat the man. And certainly Cheryl Homer talked about this on a podcast with us, that, I think she says, we have a responsibility to assess men's general health if they're struggling with their fertility.
Yes.
male fertility is a good proxy for general health. So men with fertility issues are more, I think they're more prone to certain cancers, testicular cancer, cardiovascular disease. So yeah, let's jump on this stuff early and support these men so that these issues don't, end up further down the line. But also there is a small amount of research, I believe, around genetic issues in children where the man had high DNA fragmentation. So these issues are then getting passed on to the next generation. Possible genetic issues, learning difficulties, some childhood cancers. So, you want to be making a baby with the best possible ingredients. You want that baby to be as strong, healthy, and vital as possible. And this is where men need to understand that they have this incredible opportunity by doing the right lifestyle and diet factors and getting treated and looking after their health to really impact their child's longevity and health further down the line.
Yeah, this all comes down to epigenetics. So looking at your genes and your potential. So your genes it's the book of life, but how you read the book is down to you. So how that book is expressed is all down to you and your diet and lifestyle. And there's quite a lot of research now that shows that 3-month period prior to conception in both partners actually can have a really significant effect on the long-term health of the offspring. And this is where I suppose my dream was this idea of like biohacking your family to sort of really push those genetics. But, it will come. But I think, it's a really exciting area of research. And I suppose, but for the majority of the people who come to see us, they just want to get pregnant and have a baby at the end of it. And sort of the next level is sort of, if a baby feels really unattainable, then that kind of, the rest of it is almost like not even on the menu.
It's too much to think about, isn't it, on top of everything else? So I can totally understand that. But it's just trying to get that message through to men, isn't it? It's like, yes, your wife might be nagging you about not having a beer and not going on your bike, but actually this stuff really does count. It does make a difference. And I guess that there's such a huge disconnect. There's probably a disconnect between men in terms of what they eat and drink and their sperm health. I think, we are changing that, but there's that disconnect. And like you say, that to try and connect what you're doing now in terms of the food you're eating and the way you're living your life with a child that you can't even contemplate conceiving because you seem to be just losing that battle, to then get all the way to that child's health, that's a huge thing to kind of to overcome. It's a bit like global warming and the environment and everything that we're doing around that. It's like, people can't contemplate that, that plastic bag that they've just chucked in the bin is having that much of an impact. But actually, it's too far removed.
Little things, isn't it? Yeah. The little things you can do.
So, and that's a really good way of saying it, actually. It's like the little things that you can do now as a man will have far more impact than you can ever imagine. It's the compound effect, isn't it? Which is there's a great book called The Compound Effect. How, if you stick £1 in a bank every day, by X many years, you can have this much. If you exercise your biceps once a day with X many reps, you're not going to see any improvement in 3-4 weeks. But after 3 years, you're going to be like, oh, wow, I've been working out. It makes a difference. Same with your sperm health.
Yeah. Oh, it's been great talking to you. I think you're doing really, really great work. And we are so grateful to you because, coming from a man is always going to be different. It's always going to come across different. It's always going to be, received differently. So it's really nice the way the work you're doing. So if anybody wants to find you, your podcast, get in touch, where should they go?
So the website is also a great resource, testhim.com, and we've got our free questionnaire on there that guys can complete, and that will take them through a lot of the key kind of risk elements around fertility. So medication, history, fertility history, diet, lifestyle. They can go and do that for free. Our podcasts are linked from there. Instagram is a great channel to find us on. Well, that's really where we're most kind of active at testhim Ltd. YouTube as well, so a lot of our content is repurposed onto YouTube, and then Spotify, just look up the testhim podcast. But kind of search for testhim. I think you should find us pretty easily.
Great, thanks so much, Ian.
Well, thank you for having us. Really great, just to be able to spread the word and talk about what we're doing and help all these men and couples.
I really enjoyed this chat with Ian, and I hope you enjoyed listening to this episode. Please like, save, share and rate this podcast if you have found it useful, as it helps us reach more people. Also, don't forget your 10% discounted test with Neovos using the code fertility at the checkout. And if you're looking for a fertility specialist to support you, our practitioners can be contacted over at www.fertilitynutritioncenter.org. And they all offer a free strategy call to help you decide on your next steps on your journey. Thank you for listening.